When assessing Gypsy dynamically, a low head carriage can be seen. She tends to amble and pace and laterally circumducts her right hind limb. Her hind limbs are generally very upright and are base wide behind. It seems there is very little movement of the stifles, and she has hyperextension of the hocks with very little flexion through her hind limbs. During the trot, she has a clear restricted protraction of the right hind limb, with a longer stance phase of the left hind, again with very little movement through the joints of the hind limbs.
The first condition that Gypsy may be predisposed to is patellar luxation, which is sometimes characterised by an occasional hop or skip, as seen in the video, where Gypsy hops on a beat of a stride. Dogs with this condition usually have a straight-legged appearance and a shuffling gait with a shorter stride behind.
Hyperextension of the hock joints is another predisposition to patellar luxation, as well as a steep stifle angle. This results in a stiff and awkward gait, which could be said for Gypsies. The hopping may be a compensation to avoid weight bearing. This condition is common in small breeds, such as the Parsons Terrier, like Gypsy.
It has been found that patellar luxation is linked to cruciate ligament rupture, as an increased pressure is placed upon the ligament. Steep joint angles cause malalignment, which can therefore cause focal increase in joint forces, with a loss of compliance of supporting structures such as the joint capsule, which may also predispose to osteoarthritic changes. The hyperextension of Gypsy's stifle joints may increase the tibial plateau angles, which increases the stress upon the cranial cruciate ligament.
It can be seen that Gypsy cranially loads, and dogs with cranial cruciate ligament problems have a greater stance phase in the forelimbs than the hind limbs. Gypsy also circumducts her hind limbs to avoid flexing through her joints, which may also indicate potential issues. The protraction of her right hind limb is less than that of her left, which may indicate a greater risk of cruciate ligament issues in the right hind.
Overall, the gait abnormality seen by Gypsy may predispose her to patellar luxation and concurrent cruciate ligament rupture.
Didi has diagnosed overriding dorsal spinous processes in the region of T14. As seen in the video, he is very rigid through his spine and his top line does not move freely. He has quite a lordotic posture and carries his head very high during locomotion. He has quite a stiff hind limb gait with an apparent toe drag. He laterally circumducts his hind limbs in trot with a lack of protraction in his right hind. He also has a greater ventral excursion on the right side of his pelvis. During the walk and trot, he also bears more weight on his left forelimb, which can also be heard.
Many of Didi's gait characteristics are common in horses with overriding dorsal spinous processes. His lordotic posture would have predisposed him to this condition, as there is inherent weakness of the thoracolumbar spine as well as restricted mobility. His head carriage is also typical for a horse with kissing spines, as the repeated overextension of the vertebrae is one prominent factor in the development of impingement of the thoracic dorsal spinous processes. It has also been demonstrated experimentally that elevation of the head and neck has a negative influence on back movement. Horses with overriding dorsal spinous processes usually exhibit an altered hind limb gait, resistance to work, toe drag, and a rigid posture of the thoracolumbar spine, all of which can be seen in Didi's gait.
When discussing his stiff hind limb gait, this could predispose him to lumbosacral or sacroiliac issues. Horses with lumbosacral pain tend to have a reduced hind limb propulsion, find tracking up challenging, have a crooked movement, and weight bear the forelimbs unequally, all of which could be said for Didi. As he is reluctant to flex through the joints of the hind limbs, this could predispose him to osteoarthritic changes, predominantly of the hocks, and the shortened protraction of his right hind may indicate these changes.
Overall, it is clear that DD exhibits the most common gait characteristics for horses with overriding dorsal spinous processes, and these characteristics could also predispose him to developing lumbosacral pain and osteoarthritis.